everybody, welcome back. My name is Rebecca, and tonight we're going to practice some trigger point therapy yoga. So go ahead and get into something comfy, and we're going to get started on a few different sections. So it'll pause in between each section, but we're going to work on our shoulders, especially up in our rotator cuff section. A lot of pain can happen in there, especially if you sit at a desk a lot, you lift a lot of weights, you just overall overexert or overwork your shoulders. So go ahead and grab your yoga mat and join me here for some trigger point therapy. All right, hey everybody, so I grabbed my massager and we are going to bring down and get some pressure points along our back, especially for our shoulder. So I have them kind of in a wide, as you can see, it's pretty bendable. So you want to put one of the balls right at the top of your shoulder, and then you're going to bring the other one down your back. So I'm going to turn around. You want to keep it straight. And what you're doing is you're hitting the two pressure points right above and below your shoulder. It's really releasing those pressure points right along there. I have an old rotator cuff injury from a very old physical job, and it just tore it really super bad. So this helps relieve the pressure off of that and just gives me just a little bit of a release now and then within my own body. All right, we're gonna trade sides here. I'm just gonna use the same hands again, right hand holding it, and we're just going to hold in the same spot. So as you can see from the side, the ball is right in the middle. And I'll bring around, so it's in the middle of your shoulder. If you can bring it down just a little. We're trying to find that pressure point up in our shoulder, and you just pull down, put a little bit of pressure on it, and just hold it. Like I said, we're just releasing the pressure points off of our rotator cuff and our shoulder. Really good yoga workout here. All right, let's release. All right, everybody, so if you don't already have your yoga mat out, go ahead and grab it and join me in a flat back position, laying down. You can do this in a standing or a chair, but the easiest way to do it is to lay down on your back. So I'm gonna lay, because my treatment side to floss my nerve is on my right side, but we're gonna do both shoulders so you guys can see it. So just lay as flat as you can on your back in a relaxed position. So you just want to pull your shoulder up and toward your nose. You want to keep your head facing straight up, looking up, and you want to twist your shoulder in and try to touch your nose. So you just want to bring it off. So there's one, inhale, and exhale. Inhale and exhale. Inhale and exhale. Inhale. All right, let's switch sides. We're gonna go to the left side. So you would want to repeat it, just lifting up and in. You want to try to touch your nose to your shoulder. Okay, let's switch over. And this time we're going to try to touch our nose to our shoulder. So up and in. It's actually a really good stretch. All right, look to the other side, up and in. 5 more on this side. Just lifting your shoulder up and off. So you're just lifting it like you're bringing your shoulders in. All right, that's it for the nerve floss. We'll come on in and we'll do the next step. So now we're gonna treat your trigger point. And your trigger point is right here. You can feel between your two. So you can feel between the muscles. So if you come down just a little bit, we're gonna take our 2 fingers, we're gonna go to this side, and we're gonna stretch our neck towards our shoulder. You should be able to feel when it gets tight, and that is your trigger point. And you're just gonna hold it on each side for about a minute. Yeah, it should feel a little bit of pressure. It could be a little painful, but it should just be pressure, and that's your pressure point. All right, come back to center, kind of shake out your hands. Take your 2 fingers on your left side. This is my really tight side, so you just want to come down just a little bit, and you can feel in between the muscles, and you know when it's the pressure point because it's pressure. Like I said, it's like a pressure point on your forehead. You know, sometimes you go in and the doctor will push on your pressure points and it hurts. This could hurt a little depending, and you want to turn and you want to look over. You know, this one definitely is making it tight. We're going to hold this for about a minute. You can start feeling it release too. Like I can feel more blood running to my fingers as we do this. Okay, come back to center, shake out your hands, and we'll do our last. All right, so I want you guys to come into a standing neutral mountain pose. You can have your feet hip width apart if you'd like, hands down to your side. I want you to make sure that your spine is directly over your hips and your head is over your heart. Make sure that you're standing with your pelvis in, not standing slouched. All right, we're going to stand in our neutral mountain pose, hands down at the side. I'm going to stand hip width apart, and all we're going to do is gently twist our head, look to the right, go to the opposite way, and to the left. We're gonna work our slow inhale and exhale as we do this. Okay, so inhale slow, hold, exhale, slow, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last time, we're going to hold on each side for just one inhale and exhale. So we're going to inhale, look over, exhale, inhale, and then we'll exhale, come back to the center. We want to hold for just a second longer. Inhale, hold, exhale, inhale, exhale, inhale, hold, exhale, inhale, exhale. All right, I hope that this was helpful. Continue to join me for trigger point therapy. We'll be doing lots of other points on our body. Just tonight, this one just hit kind of home, and so I just felt like we should do it. Thank you for joining me. Thank you for your support. If you'd like to come into a Shavasana for 2 to 5 minutes, that is quite up to you.